G'day, my name's Kieran Keys. I'm the Chief Executive for the Townsville Hospital and Health Service. We recently have been on a program to replace our physiological monitoring devices, and once upon a time I used to be a coronary care nurse, so I know how important these are to our clinicians, and we've been going through such a smooth rollout. My barometer as Chief Executive is whether actually somebody escalates any concerns to me, and they haven't, which means that our clinicians, together with the Mindray team, have been partnering to manage what is a potentially complex replacement program in a continuously operating clinical environment.
I joined Mindray in 2023 as the Territory Manager for North Queensland for patient monitoring and life support. So my job as a Territory Manager takes me all over North Queensland. Been to Hughenden, Richmond, Palm Island. I'm in Ingham today, Magnetic Island, and Townsville is our home base. Our goal is to connect the rural and remote centres to specialists at the Townsville Hospital. So the equipment that we have installed in the remote and rural communities is going to help connect patients to specialists in the Townsville Hospital to determine whether or not they need to travel to Townsville or if they can stay in their community and be treated.
It's well documented that patients recover better in the home. They've got their families around them, and I think a lot of the communities up in this area, particularly some of the remote areas, are a lot happier at home. There's a cultural divide of people coming into the big cities. They don't like the big cities, they don't like the modern technology. I think making people comfortable in their home environment with their families and the support network around them would be better for the patient in general.
With the new technology coming in with Mindray, it has helped quite a bit in that it's an interface system that the staff have been able to get used to very quickly. It also had some options that allowed for customization, and that allows them to be able to do things at the bedside, as well as giving us that opportunity to set the machines up in a way that we felt was appropriate across the whole department.
My name is Carly. I am currently the CNC in the intensive care unit at the Townsville University Hospital. Prior to Mindray, we were locked into a space. We had to pick a physical space in the hospital where in the event of mass casualty we would overflow into. With Mindray, it gave us the capability to do this wirelessly, and we could set up virtual bed spaces with MetaVision that we could then just change the bed IDs on the Mindray monitors and even use our transport monitors to essentially set up a virtual ICU anywhere in the hospital. So in the event that there is ever a mass casualty and the ICU needs to overflow, we can go to any place in the hospital that is then resourced to be able to support our patients.
The N17s and the N19s, the TM80s as well, and the N15 monitors. I guess we're the workhorse for our facility. We introduce them into a lot of the ward areas and into our theatre areas. The devices themselves are really robust. We've had a lot of good feedback from clinicians, and that's been quite rewarding. I think it's really paid off, and it'll pay off in the long term.
Daily workflow in the emergency department has changed with the Mindray units, mainly because the N1s are quite small, and it allows us to move with that module between our front of house areas such as triage through to our resus room and then into the bedside with that monitor and the equipment that is monitoring that patient, moving with them through those spaces. It's also allowed us to be able to use that same monitor when we transfer someone, say, to theatre, ICU, or up to the wards. So all of that information stays with that patient throughout their whole journey.
One of the anxieties as a Chief Executive is whenever you're embarking on a replacement program of any technology is that, when the vendor walks away, that all of a sudden you're left without support. And that hasn't been our experience with Mindray. We've been ably supported, certainly during and after the rollout of this new technology.